Hi, Michael O'Doherty here. Hope everybody's doing well. Just coming on to talk with you a little bit about long COVID, some of these symptoms that we are seeing in our clinic every week now. Many people are suffering from chronic fatigue, of course, and on top of that, they have poor concentration, focus, as well as sometimes vision issues, maybe dizziness, vertigo, that type of stuff. Now, the reality is that it's obvious first that you get your medical analysis done to make sure everything is fine, but we are seeing a lot of this in our clinic. If you are somebody out there who is struggling with trying to understand why it is that you have brain fog, why you have so much fatigue, or your concentration and your focus is off, even your memory, all of these types of things can be attributed to what is deemed to be the COVID virus. Also, of course, we're seeing a lot of children and people who have symptoms similar to POTS, and some children who have POTS syndrome. In actual fact, we've had cases in our clinic where we've referred them on to cardiologists or whatever to have a proper analysis done. POTS is a postural orthostatic tachycardia, is what it means, syndrome, and that has multiple of symptoms from when people stand up, their heart rate is elevated, and then of course often the blood pressure drops. However, the blood pressure can go up or down, it varies. But often the case is then that people will feel very faint, very dizzy, and maybe collapse. Unfortunately, we're seeing patients that have been told, or young people that have been told, that this is something like anxiety or depression. It may very well be, but I think unless it's properly assessed, and I think a lot of people are not having proper assessment done, and they're accepting that that is the way it is and that is the way it is. So ultimately what we need to try and do now for patients is to try and get them to understand a little bit more about how the virus has affected the system. So we now understand that from research is that the virus itself, particularly in the upper respiratory region, is influencing the brain, because what's happening is the neuronal connection from the brain to the nasal passages. This is where the virus builds up and is highly active. When that virus breaks the blood-brain barrier down, what's happening is that it's causing an inflammatory reaction in the brain, and it's often the immune response in the brain that's and in different parts of the body, of course, that's causing the problem. And when you have an immune response in the brain, like an increase in certain immune activity that damages blood vessels, then this is what is deemed to be affecting poor concentration, focus, headaches, fatigue, and lots of other things. In our clinic, because we have a lot of research done in this area, because I do a lot of work in post-viral fatigue area, we have developed the skills to work to release that overload of the brain, to release the overload of the system, and then of course to work with nutrition on top of the energy work to get the body's immune system back up and functioning normally again, because of it's overloading the body's systems. Now, the critical thing about it is that sleep, when people are stressed or anxious or not functioning properly because of the viral overload, and because they're not able to get to work or they're not able to sort of function on a daily basis, this is for sure causing different types of anxiety and stress. We deal with this very effectively in our clinics. The thing about it is that I suppose when you look at sleep itself, we go through different cycles of sleep and different stages through those cycles. And if this disrupts your sleep, which it does, while you might feel you're sleeping, but you may not be going through the necessary stages of sleep. And if you don't go into the proper stages of sleep, then the brain can't recover. So we have found that by working with the energy system, by supporting that with the right nutrition, by targeting the viral overload, by talking to people about the right types of exercises they need to do, that combination can increase blood flow, boost the immune system, and most importantly, begin to bring down that overload of the nervous system, begin to release that overload of inflammation of the brain, allowing sleep to become very natural from there. And once the sleep, get into that natural sleep process, then the brain can begin to regenerate, and indeed the body can begin to regenerate. So that's sleep cycles, the amount of sleep cycles and the different stages we go through of sleep. And that's critical if you're going to recover from any kind of a virus. So while some people, I believe, now are prescribing antidepressants and antibiotics and all of that, that may be helpful, but it may not necessarily solve the problem. So if you are one of those people out there who is suffering from fatigue, post-viral fatigue, deemed from COVID, long COVID, then certainly that is an area we have now been working with for a period of time, and we're able to understand it a little bit more. And because of our experience over the years, we can certainly help people a lot with this area. That might help you to understand it a little bit more, that it's really about the immune's response to the virus that is causing the problem, and we need to shut that response down. And I think if we can do that by working the way we work, it can help people hugely. So I hope that helps you a little bit. If you have any query at all around the treatment or around COVID virus or how it's affecting the body, what research has been shown to prove exactly what I'm saying, please don't hesitate to ask me, leave a message at the bottom of this video. Please share and like, we'd appreciate it. But any query, only too delighted to help. Talk to you soon. Bye-bye.